I'm Dr. Kate Uttech with New Journey Physical Therapy, and I wanted to talk to you today about exercises for rectus diastasis. I get asked this question all the time, so I wanted to put together a quick video just going over what that really should look like. Unfortunately, rectus diastasis is something that I do recommend working on with the guidance of a physical therapist, whether you are in treatment or you get an evaluation and then have recommendations that you follow. I want you working with someone who really knows how to help you really retrain your muscles. Diastasis is an issue where your brain and your muscles are not communicating well together. That's why you still have your separation, or that's why you still feel weak through those abdominal muscles. It's not just a quick fix. It's not something where I can just give you exercises and you can fix it on your own. I want you to work with someone. That being said, I can give you information on what that process should look like, or at least what I think that process should look like, to make sure that you can assess the care that you're receiving and that you can look at the things that you're doing in your life and maybe maximize the benefit until you get into care. So, one major step that's really important in terms of healing diastasis and getting back that core strength is to reset your breathing. I want you to reset your breathing so that you can maximize your diaphragm. If you are breathing up like this, chest breathing, using your accessory muscles, that's what we should look like at the end of a marathon. That is not what we should look like at rest. So if that's how you're breathing, you're not maximizing your diaphragm and you're not engaging your core and your pelvic floor with your breath. That's not going to help you heal a diastasis and get stronger and reconnected to your core. So resetting your breathing, super important. Then you also need to reset your alignment, your rib cage alignment, your pelvic alignment, each individually, and then how they align and connect together. Your rib cage should be a bowl facing down, and your pelvis is a bowl facing up, and they should be connected. They should be facing towards each other. If they're like this, you can't build that connection, and your abdominal muscles are just going to have a harder time connecting and engaging. That's not to say you should live your life all the time perfectly in neutral spine. I don't want you doing that. I want you to feel like you can live with variety in your life and that you can move through a variety of positions and still feel good. But that does mean that as you re-educate your muscles how to listen to the brain and how to engage, it's going to be really important that you focus at least some portion of your day, ideally when you're exercising, on making sure that your abdominal muscles are in a position that they will have the easiest time connecting. Let's not make it more difficult for them. Putting your pelvis and your rib cage not facing each other like this puts your abdominal muscles on a weird angle where they're stretched and it's not easy for them to engage. Let's make it easy for them to engage while they're having trouble in other ways so that they can listen to the brain, learn how to engage correctly, connect, and get stronger. And then you're going to feel better connection to them. And the last piece, after you've done breathing, you've done that alignment work, you're really breathing nicely, you know what that alignment feels like, it's about re-engaging your muscles on how to contract and engage your abdominal muscles and your pelvic floor muscles. What you want to be looking for is faults. If you feel strong when you engage your abdominal muscles and your pelvic floor muscles, you feel connected to them, you feel like you know that you are engaging them well in the right pattern, okay, maybe you don't need to be following someone. But if you're feeling like you don't know how to work with your diastasis or you're feeling weak through your core, then you should be seeing someone. And the way that's going to feel is if you just feel weak and you're not sure what you're doing, then you might not know what you're doing and you might need help. I also want you to be constantly looking. If you feel a leak or you feel downward pressure or outward pressure, so down pressure through your pelvis, through your pelvic floor, outward pressure through your abdominal muscles where that separation would be, or you're feeling yourself with a urinary leak, that means that you're not managing pressure well through your abdomen, through your pelvic floor, and that those muscles aren't working well together. That may mean you need to refocus and that you can continue with the exercise, or that may mean that exercise is too hard for you right now If you're unable to find exercises where you feel confident that you are doing them correctly without feeling pressured down or out and without leaking, then you definitely need to call someone right now. Me if you're local, someone else if you're local, or someone else if you're far away, or me if you want to do telehealth with me from far away. But I want you to be following with someone that can re-educate you on what sensations you should feel to know that you're doing these exercises correctly. Hopefully that helps. Hopefully that gives you an idea of how to get started, how to connect with your body a little bit, and what you should be looking for to really know that this isn't working and you need to get help with someone else. You need some guidance. Have a great day, and I hope that helped.